Okay, I'm James Park. Hello, Professor Cooper. This is my patient Lisa. Lisa, do we have your permission to do an exam on you and upload it to YouTube for public viewing?
Yes.
Okay. All right, so we are going to do the neurological exam first, or today. The first part of that is assessing the patient's level of consciousness. She's obviously conscious. So if they weren't, you would do a Glasgow coma scale, but as we go through the neurological exam, we're going to obviously find out that she is conscious. So the next thing we're going to do is ask them orient them to time and place. What is your name?
Lisa.
Where do you live?
Fort Worth, Texas.
What year is it? The date? For what the date is?
December 6th, 2020.
Okay. Who's president?
Trump.
Okay. So obviously she is oriented to time and place. The next thing that we're going to assess is her speech. Well, we just did the assessment of the speech. She isn't slurring her words. So there's no issues, like suspected stroke or anything like that. So her speech assessment is fine. The next thing we're going to do is assess her memory. So remote memory, where did you go to high school?
LD Bell.
Okay. And then what did you have for breakfast today?
Cinnamon toast.
Okay, so that's remote memory and current memory, and that all is fine. Okay, and then remote memory, that's it. Memory. Oh yeah, and then we're gonna do ask about her reasoning process. If you're walking down the street and you found a envelope that was stamped, just laying on the floor, and there was happened to be a post office box there, what would you do in that instance?
Put it in the post office box.
Okay, great. So her reasoning skills are all fine and dandy, so we're going to move on. We're going to start with the cranial nerves. Cranial nerve 1 is olfactory nerve. So what I'm going to do is I'm going to have you close your eyes. Then, first of all, include one nostril, please, and breathe in. Can you breathe through that one? Yeah?
Yes.
Okay, and do the other side. Can you breathe through that one? Okay.
Yes.
Okay, great. So what we're going to do, you're going to close your eyes. We're going to include one nostril. I will have you include one, and I'm going to have you smell something, and tell me what you smell. So go ahead and close your eyes. And can you tell me what you smell there?
Vanilla.
Smell again.
Oh, cinnamon.
Okay.
Sorry.
All right, no problem. Let's do the other eye, or the other nose. Close your eyes. This one.
Vanilla.
Sure about that?
Yes, sure.
Okay, gotcha. Okay, so that's olfactory nerve. The next thing we're going to do is go to our Snellen chart. We're going to the optic nerve. That's cranial nerve 2. So you would do this 6 feet away. We don't have that room here, but we're going to have the patient. You're going to close one eye, and you're going to read the lines from 6 feet. Obviously, you don't have to do that, but you would read the lines as best you could. You're going to switch to the other eye. Same thing. You're going to read that 6 feet away, and then you can read it with both. And so that is your Snellen chart right there. So that's what we're going to do on that one. The other thing we're going to do is check her visual fields. So I would start in front, and I'm going to come. So what I'm going to do is you're going to basically look straight ahead, and you're going to tell me when my hands come into your field of vision. Okay. And so we'd start out here.
Now.
Okay. And then you're going to go superior and inferior.
Now.
No, both of those. Okay. Mm-hmm. So you're going to do lateral. You're going to do superior and inferior. So that's also for cranial optic nerve. The next thing we're going to do is, let's see here. Well, we're going to do let's do it this way. Let's do the light reflex, so red reflex, and I want you to just look straight ahead, and I'm going to look for her red reflex in her eye, and then there it is. So my right eye goes to her right eye, look straight ahead, and there it is. That looks good too. So that's awesome. That's what you want to see. And on this, we're also going to go ahead and check for pupillary constriction. You're going to do it on both sides. So you're going to come over here with the light, and it's going to constrict on the the same side. And so you'll check the other side. You're going to check that. Okay. And so you want those to constrict. And now you also want to make sure that they accommodate. So when you check the right, the left should also accommodate. Vice versa, you check the left, it should also accommodate. Another way of doing that would be the near-far test. You will just look at a point, like that number right there on the microwave, and then focus on that. And so look away at that, and then I want you to look over here at the end of the pin. So look at that, and then back to here, and then back and here. Same thing. Okay. And so that's near-far test. Again, you should see the pupils are supposed to constrict. That's what should happen. Then we're going to go and look in the eye, the actual eye. So again, right eye, look straight ahead. Watch your hand. Keep your hand away. Your head from banging. Yeah. So you look for the disc and cup. Physiological cup should be half the size or less than the disc. The disc margin should be sharp. You should see no hemorrhages or exudates or anything like that. On the left side, you're going to do it over here. Actually, okay. So that is the internal exam of the eye. Sclera should be white. Conjunctiva should be pink. Looks good. Now we're going to go to cardinal fields. This is going to be cranial nerves 3, oculomotor, trochlear, cranial nerve 4, and 6, abducens. So to do that, take anything really on the edge of this. Follow this with your eyes. Don't move your head. And you're going to make a big H, basically. And then down, this, up, this, and then together. Is convergence right there. So that's all good. Cranial nerve 3 is going to be all superior. Your abducens is your lateral, so it's going to move the eyes outward. And inferior and medial is going to be your cranial nerve 4. Cranial nerve 5 is your trigeminal nerve. And to do that, we're going to do, well, you're going to check the 3 different branches. So there's 3 branches to the trigeminal nerve, and you're going to tell me, is this sharp or soft? So,
Soft.
Yeah, what's that?
Soft.
That's soft.
Mm-hmm.
What about this?
Sharp.
This?
Sharp. Soft. Not a big difference.
Let me poke
Sharp.
over. Okay.
There you go.
There you go. And we'll do the other side.
Sharp. Soft. Soft. Sharp.
And then up in here. Same thing. Okay? So that is the sensory portion of the trigeminal nerve. We're going to palpate the masseter muscles. And you're going to palpate the TMJ, clench your jaw, move your jaw from side to side. Okay? Show me okay, good deal. Alright, so that's cranial nerve 5. Yep. Trigeminal, we did 6 already. 7 is facial nerve. So on this one, you're going to do, like, raise your eyebrows real high, and then frown. Okay? Puff out your cheeks. Okay? Okay, that's good. Open your mouth. Show me your teeth. Okay, good. All right, that's good. All right, so that's cranial nerve 7, that's facial. Moving on to cranial nerve 8, we're going to start with the whisper test. I'm going to occlude one ear, whisper in the other, and you're going to repeat what I say. do it on the other side.
Football.
Okay, great. So that's your whisper test. You can do it with a clock. I don't have one, but it would be clock ticking. See if they can hear the clock ticking. Okay, so moving forward, we're going to go to do the Weber test. You're going to hit the tuning fork, and you're going to put it on the head, and you're going to tell me, do you hear it on equal on both sides? This tuning fork's terrible.
Yes.
So it's equal on both sides?
Mm-hmm.
Okay, so that's what you want. So if it did not do that, you may have an occlusion or a, occlusion on the side that it lateralizes to is you're going to have some kind of occlusion. And then, so Weber, Ryan's or Renee's test is you're going to hit the tuning fork. It's going to go on the mastoid. And whenever you stop hearing it, tell me, can you even hear it at all?
Just stop. I heard it.
Like you did. Okay, and then it's going to go to this side.
Stop.
Same thing, both sides. You're going to check both ears, and the air conduction should be at least twice as long as the bone conduction for sure. So that's it, really. Cranial nerve 8, 9, and 10. 9 and 10. Subglossal and vagus nerve. So, oh yeah, we're gonna do. I don't have a tongue depressor, but I would say to open your. You're gonna open your mouth. I'm gonna push it down. Open and say "ah." Just say "ah."
Ah.
Okay, that's good. So we're looking for the soft palate movement, hard palate if it moves. We're looking for the uvula to see if it moves up, which it should. And then I would test the gag reflex, but I'm not going to do that. But that would be your cranial nerve 10. That's it. Then you got your spinal accessory nerve, and you are going to cranial nerve 11. I want you to bend your head to your left against resistance, bend your head to your right against resistance, shrug your shoulders. There you go. That's it. And cranial nerve 12, you're going to stick out your tongue all the way. Okay, that's good. Now push your tongue against my hand over here on this side and on this side, and there you go. Okay, so that should do it for all the cranial nerves. Yeah. 1 through 12. Got them all. Great. Okay, so next we're going to do cerebellar test. So cerebellar test, I'm going to have the patient, you're going to stand up for me, walk 3 or 4 or 5 steps that way, and then return. And then you're going to walk on your heels. Walk to me. Turn around, walk on your toes. Okay, great. Now when you come back, you're going to walk in tandem, so it's going to be heel to toe, just like this. Great. Perfect. Okay, stand right here. You can actually stand right there. Now we're going to do a Romberg's test. So you're going to hold your arms out like this, eyes closed, and you're checking for any type of motion or movement. Put your head back just a bit. There you go. So you're looking for sway, if there's any cerebellar problems or changes right there. And then you're going to do a pronator test, so it should be in the same position. And I'm going to push down. Close your eyes. I'm going to push down, and they should come back to where they were before. Okay, great, and they do. So you can have a seat there. Yeah, that's right. Then you're going to do, so what I want you to do is look at my finger. Actually, let's do it this way. Just here you're going to touch my fingers and then back to your nose, just like that. So go ahead, touch your fingers to your nose. To your fingers, to your nose. This one. Your fingers to your nose. To your fingers to your nose. Okay, so the last cerebellar test. Riley, come here. Oh. Okay, so Riley's gone now. Okay. And now you're gonna do fast hands. So I want you to do this as fast as you can. Over, back, over, back, over, back, over, back. Good. Okay, it's all good. Those are all your cerebellar test. And so next we're gonna move on to sensory testing. Oh yeah. So sensory testing. So now I'm gonna have you. What I'm gonna do is you're gonna close your eyes, and I'm gonna move your finger up or down, and you're gonna tell me, is it up or is it down? Okay, so is your finger up or down?
Up. Down. Up. Down.
And then we'll do it on the other side.
Up.
Mhm.
Down.
Mhm.
Down. Up.
Okay, and you can actually do that. You might want to scoot back a little bit, but we're gonna do other toes and
Up. Down. Up. Down. Up. Down. Down. Up.
okay, great. All right, and then we're gonna do 2-point discrimination, and we're gonna need 2 points. So on this, you're gonna take your fingers out. You're gonna close your eyes again. I want you to tell me if you feel 2 sharp things or 1 sharp thing.
Okay.
All right, close your eyes.
1, 2, 2, 1, 1, 2, 2, 2, 1, 2, 1.
Okay.
2, 2.
All right. So obviously, in the hands and the feet, you're gonna have a lot more discernible, fine sensory skills. Next, we're gonna do is stereognosis, and you are gonna, or this is graphesthesia. Graphesthesia, I'm gonna write something in your hand. Close your eyes. Tell me what you feel.
7,
Mm-hmm. This one.
8,
Okay, well, it should be a 4, but that's close enough. That's graphesthesia. Stereognosis is put this in your hand, close your hand. Tell me what that is, maybe.
screw,
Okay, yeah, pretty much. Okay, you're gonna take a tuning fork on the lower extremities, and you should be able to feel that. You feel vibration there.
yes,
Feel vibration there.
yes,
Okay. And then we're gonna do soft and sharp. Tell me if you feel it soft or sharp on wherever. Close your eyes up. Okay.
soft, sharp, sharp, soft, sharp, soft, soft, sharp,
Same thing. The lower extremities.
sharp, soft, sharp, soft.
Okay. Okay. So that is that. Tuning fork. We did it. Start graphing. Okay. I think we got it all on that. So those are your sensory tests. Next, we're going to do a motor test, motor skills test. And you can put your arms up like this. I'm going to push down. I want you to hold strong. There we go. Hold them right here. Hold strong. Great. Push down. That's good. And take your hands out like this. This hand And I'm going to squeeze them together. Don't let me, okay? So there we go there. There we go there. Now squeeze together. Squeeze together your hand like this. There you go. Okay? Hand up like this. And go down like this. Hand up like that. Go down like that. We're going to do push your foot toward me. Push your foot towards me. I'm sorry, your leg, excuse me. Pull your leg back. Pull your leg back. You're going to put your, raise your foot up. Just your foot. Now push it down like the gas pedal. Raise your foot up. Push it down like the gas pedal. Squeeze my toes, or with your toes. Squeeze with your toes. We need to do hip. So you're going to lay on your back real quick. This up. This up. Now raise your leg up this way. Good. And the other leg up. Okay, good. There we go. Squeeze your legs together. Spread your legs apart. Okay, great. Alright, so come on up, have a seat. So we're testing for motor. It's graded 1 through 5. 505 is normal. We did everything from biceps, triceps, brachioradialis. You got your fingers and intrinsic muscles, your hips, your thighs, legs, hamstrings, calves, feet. Really, that's all. It's all of them. Yeah, that's it. Okay, all the muscle groups. Basically, you're testing all the muscle groups. Then we're going to deep tendon reflexes. And to do deep tendons, we're going to start with triceps. You're going to drop your arm down. And it's right here. You're looking for a little motion right there. Brachioradialis. You're going to look at it and see it right there. Every time. And there. There. Okay, great. Now scoot back a little bit and keep your legs dangling, essentially. So patellar reflex here. Patellar reflex here. And Achilles. Achilles. And popliteal. Do you have popliteal? You'll have to actually lay face down. You get that. And that's going to be back in here. And you can grab the tendon and then hit right on your own hand. And you should feel it move. Right there. Okay, lay face up for me. Last one is Babinski's reflex. You're going to take your DTR hammer and you're going to swipe it on the foot. Doesn't have much of a reaction, but there you go. All right, come on up. And so on the Babinski's, it's going to flex. The toes are going to go into flexion. And that is all. Sensory, motor, DTRs, Babinski's. All right. That one's good. I expect that I didn't miss anything on that one. So thank you very much, and we'll see you at the head to toe on Thursday.